we're here today with Mr. Fryman. Mr. Fryman had regenerative stem cell therapy injections in his lower back approximately 6 weeks ago today, and we're here to talk to him about his progress. So tell me a little bit about how long you've had lower back pain, sir.
I joined the Navy when I was very young, and within 2 years of being in the Navy and having to bend over through all the decks and stuff, I started having lower back problems at that time.
Okay, so it's been about, what, 30 plus years?
35 years.
Okay, 35 years, all right. So
the first thing that it affects when it starts getting really serious is your gait. You know, you have to shorten up your gait a lot. You're taking small steps. You're always afraid of that jolt, you know, when you have it and it jerks your whole body, and then you just kind of got to sit down and you know, try to hope that the pain doesn't get worse. I'm fortunate enough to work for a good company and I'm a disabled veteran, and they were nice enough to hire me, and it's, you know, they know that I'm a little slower than everybody else, you know, when it comes to getting around, and they've been very supportive with that. You know, I saw several chiropractors. Some were good, some were bad. I got Toradol shots all the time in the Navy. They knew me by name because when I'd walk into the clinic and I didn't sign in or nothing. I just went back to the treatment area and they'd give me a shot and I'd be on my way. But
all right. So you told me something interesting that that you went to see an orthopedic surgeon about your back, and what did they tell you?
They told me that L1 through L5 were just destroyed. The cartilage between L1 and L5 were just destroyed. And if anything, it would probably, any solution that they could come up with would just make it worse.
Okay, so surgery wasn't an option.
Correct.
Because of all your discs, they were pretty much degenerative, and it was a pretty significant change. So yes, taking a look at your x-rays, I agree. There was a lot of degenerative changes at every single vertebral disc, so I do agree with that. So at that basic point, your options were essentially just cope with it and try to deal with the pain as much as you could, and it was getting worse, correct?
Correct.
Right. So we performed the regenerative treatment on you. Again, it was 6 weeks ago today, I believe. And so I believe we talked about it before, your pain was a 10 prior to the injections. What would you say your pain level on average is now 6 weeks after the treatment?
I'd say about a 2. And a lot of that is not my back. It's because I'm having to walk differently now. I can actually take a stride. So I'm using different muscles in my leg to get around. And I'd say most of the pain is down in my legs, just trying to get back in shape and get the muscles toned back up from, you know, having a gated step. And so.
Well, fantastic. So, I mean, that's anywhere from 100% to an 80 to 100% improvement in just 6 weeks. And I mean, we still have a long way to go. This is the process. I don't want people to get the misunderstanding or think that you can get everything resolved in 6 weeks, but this is a typical outcome that we see. A person with severe low back issues typically get very good response. So again, we really appreciate you sitting down and talking with us. As someone 6'8", a retired military, and also one thing, we do have a military discount program, as you're aware of.
Yes.
And we really appreciate our veterans, and we want to do all we can to help everyone. And so once again, I appreciate you so much for sitting down with us, and we look forward to continuing your progress, and we're thankful that we'll be able to be part of your treatment. So once again, thank you for Mr. Fryman for talking with us today.
My pleasure.